The fourth and final day of the Bloomberg New Economy Forum is focusing on the future of healthcare around the globe in the wake of the coronavirus pandemic, which, as of now, has killed over 1.3 million people. Earlier today, Bill Gates reacted to the U.S. response to the crisis. Take a look.
In the case of the U.S., the only thing they've done well is they funded more R&D, not just for U.S.-based companies, but for companies around the world, including a lot of these European constructs. And, that was a good thing. That was a favor to the world. The rest of it, the U.S. is sort of at the back of the pack. The diagnostic work we did, the messaging, even today, the messaging is reaching a new level of incoherence.
Just on that, very quickly, I'm going to come back to vaccines, but you look at the numbers. I just looked again on the Bloomberg virus tracker. You look at the deaths for every million people. America's now close to 750 deaths. China, the other great participant in this conference, is around 3 deaths for every million people. Obviously, one number may be a bit overcounted, the other bit undercounted, but by any measure, one country has done enormously better than the other. Why has the US been so bad compared with other people?
I don't think comparing China and the US is that helpful, because China has a more authoritarian control over behavior than the US does. But if you compare the US to South Korea, Australia, the contrast is every bit as dramatic as it is with China. And so we didn't catch the epidemic at that early stage where the numbers are small before they get exponentially big. And we are facing, which the IHME model predicted, that the fall will be very tough. Some people didn't think the fall would be tough, but as they had looked at the numbers and saw in places like Brazil how the austral winter affected infection rates, they saw that. And so the bad news is the next 6 months in the Northern Hemisphere will be very tough. The good news is that both the vaccines and the therapeutics, in particular the antibodies, are coming along and will start to bring that number way down.
But up to that point, presumably we must rely on masks and all these things that America has not been, and testing especially.
That's right. The behavior, the using the test for people, and then if they test positive, you contact trace, and those people make sure they're not infecting other people. The U.S. still has a long ways to go on that. Although the numbers are so extreme, you do have finally more agreement that restaurants, bars, a number of things will have to forgo during this next 5-month period.
Were you surprised by how badly America has done on that? Very quickly.
Oh, it's mind-blowing. We have so many more PCR machines than per capita than any other country. We have the CDC that has the deep expertise and had practiced how to communicate appropriately to the public. They made some mistakes early on, then they were completely muzzled. Nobody even knows the name of the people underneath Redfield who would have been the key communicators. And we had this so-called task force. So it is disappointing. We don't get to go back and change that. But we still have a chance to wear masks. In fact, that at healthdata.org, that's the IHME forecast, they show a line that if you have good mask wearing, that you save now over 100,000 deaths in the US over the next 6 months.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.